My memo tonight stems from a statement that I had earlier today from the CAC Health of Garissa County on COVID-19 infections in that county. He was complaining about a trend that could spell tougher times ahead for that county. The CAC fears that the number of people who have contracted the virus in that county could be much higher than what it is known now. Why? Because residents are refusing to go to hospital or seek any professional help because of stigma. Many of the patients are afraid that if they are found to have contracted the virus, they'll be isolated and kept away from their families. So instead, they choose to suffer in silence at home, in the process infecting others around them. A spot check on the streets of Garissa shows a total disregard for COVID-19 protocols. Residents are said to be under the misconception that corona is a flu like any other and thus do not see the need to wash hands, maintain social distancing, nor wear masks. The belief is they'll get better with home remedies. After all, it is just another cold, they say. Yet because of this attitude, doctors now say most patients arrived at their facilities when it's almost too late. They often are already in critical condition and are in dire need of specialized treatment that may not be readily available. It is worrying that this is the thinking a whole year after the disease was first detected in Kenya. Who has dropped the ball in Garissa and perhaps in the neighboring counties? Some observers say the fear these residents have of admitting that they have the virus could be because of the descriptions they have heard of COVID-19. That it is a lonely disease, that one suffers alone, fights the disease alone, recovers alone, or in the worst case, dies alone. Usually when one is ill, visitors come to check on them, bring food and generally keep one company. But with corona, it is a deadly and highly contagious virus, thus keeping away is standard procedure. This bringing to light what COVID-19 truly is. True as this may be, it surely cannot be reason enough to live a carefree life and keep away from help when it is most necessary. This kind of stigma was for many years blamed for the slow uptake of ARVs in some parts of the country, as people feared to be known to have contracted the HIV virus. That has since improved, but it still remains a challenge, and the cost in terms of human life has been staggering. To be sure, COVID-19 is far more transmissible than HIV, and it needs more urgent treatment. That is why this trend in Garissa must be nipped in the bud before it turns into a disaster in a region that already has many disadvantages to grapple with. There is no denying that COVID-19 is still a real and present danger in the country. The infection rate may be dropping, but you're not out of the woods yet. The country is still recording deaths in the double digits. And now there's that alarming news that the Indian variant of the disease has already been detected in the country. 5 men who arrived from India on diverse days in April and travelled to Kisumu were found to have the variant. The 5 are said to be factory workers at the Kibos sugar factory. Questions are already being raised about how the 5 could have travelled all the way from Nairobi to Kisumu while there was a lockdown in another place. That is a story for another day, but it underscores just how vigilant you all need to be. And to have people who are still too afraid to say they have contracted COVID-19 is indeed a wake-up call, not just to officials in Garissa County, but to the whole country. It is a reminder that new challenges may yet lie ahead with this ever-evolving fight against the global pandemic. And that is my memo.